So congenital disorders or birth defects are defined as abnormalities of body structure or function that are present at birth. Now, some are very obvious at birth, while others manifest later on in life. Now, there are many birth defects ranging from minor ones such as color blindness to serious and sometimes fatal ones. In fact, according to the World Health Organization, an estimated 303,000 newborns die within 4 weeks of birth every year worldwide due to birth defects. In South Africa, birth defects were the third highest cause of early neonatal deaths in the Western Cape province in 2017. Now, the most commonly seen birth defects are heart defects, neural tube defects, Down syndrome, and cleft and lift palate. Today we discuss birth defects, but we're going to focus on cleft, lift, and palate. Now, we'll be joined in studio by a maxillofacial and oral surgeon, a speech therapist, operations director from the Smile Foundation, and two parents of children with birth defects to share their experience with us. We invite you to be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call in that case is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show ahead, coming to you just after a short break. I'm Dr. Salome Taung, and this is Health Talk.
Ekurhuleni Artisans and Skills Training Center is a practical artisans and skills development center who equips students with the necessary knowledge and practical experience to enter the labor force as semi-skilled workers. There is a strong focus and need for skills training in specific areas like boiler making, rigging, pipe fitting, welding, CNC programming, plumbing, electrical, air conditioning and refrigeration, bricklaying, carpentry and painting at the center. Ensure your future today with the Ekurhuleni Artisans and Skills Training Center.
Life can throw all sorts of surprises at you, often when you least expect it.
Sorry, Mom.
That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
This week on Trends Travel, we took a short lift to Sun City Resort in the Northwest for a luxurious pamper party. The Market Theatres brought back the 75-year-old production of The Little Prince to stage with a South African twist. On the big screen, we celebrated our very own at the opening of Hunter Killer, where South African director Donovan Marsh debuted an American film starring Jared Butler. Keep it locked to SABC News this Saturday at 7 p.m.
The first time I saw Alex and I saw his condition, I cried. I was jittery. It's my firstborn. I don't know what to do.
You don't see it anymore after a while. And if he smiles, that's the best part.
When he wakes up in the morning before I go to work, he's waking up with smiles. It's also making my day. Sometimes it's difficult. Every day we learn something new.
The first time I tried to feed him, it got stuck in his palate and choked. that was one of the scariest things, and that's what happens every day, basically.
I was quite worried about Alex, especially when he's going to start his schooling. I know how what children is like on school.
Most of the people is making joke because of his condition. I get mad. We didn't know what we're going to do.
When I operation ya fence ya mlukisa, it took 45 minutes. What's happening?
It feels wonderful.
Setli bila senke ka no bona or ka utlwa o bolela ka lo tsa tswana tse.
Fetsa moroka mone ke metse gore maybe nka kenya go mo direla ntengwe e kgolo ke mirele party ke ba bitse ka moka ba tle ba mmone.
All right, so we're going to learn more about, these birth defects, cleft lip and palate from our special guest, and it's a great pleasure to welcome, firstly, Dr. Amy Nokaneng, who's a maxillofacial and oral surgeon, and also clinical head of the unit in that department of maxillofacial and oral surgery at Wits University. Welcome to Health Talk, Dr. Nokaneng. All right, and next to Dr. Nokaneng is Moira Gerst. Moira is the Operations Executive Director of Smile Foundation. Welcome to Health Talk.
Thank you very much, Doctor.
And I said, Gerst, Moira, of course.
Thank you.
Right. You're going to tell us a little more about the Smile Foundation, because we played that clip earlier on about the power that a smile from a child has on anybody. But let's talk birth defects.
Yes.
I know that we're talking here about cleft lip and palate. That's a focus.
Yes.
But just to make the point that there are other birth defects that are commonly seen. From your perspective, let's focus on the face.
Yes.
What do we see commonly?
What we see commonly is the cleft, as you've mentioned, the cleft lip, as well as the alveolus, which is the structure that holds your teeth, as well as the palate, which is the structure that separates your nose from the oral cavity or your mouth.
Right.
Yeah. But unfortunately, some of those defects, they can come as an isolated, or they can be in combination with a syndrome. For instance, Treacher-Carlin syndrome, where mid part of your face doesn't form so well. So this part of your face doesn't form so well. Then quite often it comes associated with a cleft.
Right.
The other most common one is what we call the Pierre-Robin sequence, where your tongue does not, at a certain time of your development, the tongue is supposed to move from a certain point to a lower point. And if that doesn't happen, it interferes with the formation of your palate. And hence you have a cleft palate.
Okay, so let's talk about a cleft palate now. What cleft? So you hear about cleft palate on the one hand, you hear about cleft lip, or a combination of both. What are we talking about?
Okay, a cleft, it really means that there's a split or a separation of your tissues or your body parts. Okay, during neonatal development, or fetal development rather, your face actually develops in two parts. And at some stage, starting from the fourth week of development, they're supposed to come together.
This development we're talking about, by the way, in simple terms, is during pregnancy.
Yes.
Right.
Yeah.
Okay.
Right. Quite serious.
Okay, and then,
so the face is supposed to come together at a certain point, starting from the fourth week up until around about the 12th week of development.
Yes.
And if this sequence is not followed to the T.
We're going to try and play a clip, just so that at least for our viewers it's very clear what we're talking about. So you're saying something goes wrong in development.
And these two parts of the face do not come together, and hence they form what we call that cleft, or that split, or that separation.
Right. It's almost like a well. Okay, so this is what's normally
Yes,
supposed to happen, and
that's
it
what's
closes.
supposed to happen and close.
Okay, and if it doesn't close, it leaves that space.
That gap between the two, the left and the right side of the face.
Right.
Okay.
Moira, this is something that we see quite commonly, as you know, the doctor has said. From the point of view of the Smile Foundation, we shared some numbers earlier, but do we know the true extent of this problem?
Not really. There are many children, as they said, in Africa, 1 in 750 children are born, but it varies. And with the better, collation of information and contacts, from around the country, these kinds of stats will be able to be improved on and brought up to date.
Right. Yeah. So we spoke earlier about, or do you want to perhaps just comment on...
The unfortunate thing with our surveillance mechanisms or systems at the moment, that is that they're based basically in the tertiary institutions.
Right.
And then quite often we leave out the patients in the peripheral or the rural areas.
Yeah.
So what we have at the moment is just people who are close to the tertiary centres and who are able to get treatment. But in my opinion is that there are quite a lot of patients out there who are not aware of such conditions.
In fact, let's be blunt about it.
Yes.
There are patients out there that are hidden.
Yes,
or
exactly.
Children that are hidden by their parents because of how they look.
Yeah.
Correct.
Yeah. Yes.
Okay. I promised ourselves earlier to ask you to tell us about the Smile Foundation. What is the Smile Foundation?
We are a registered NGO. It was originally started by the late Mr. Nelson Mandela in 2000. And we support the tertiary institutions in this country now. Started in Wits, and we work with the holistic team, the Max Fax, we work with the plastic surgeons, and we really assist within the public health sector with the surgeries, the surgical aspect, and any additional medical equipment and things.
So when you say assist, I mean, do you go and get those cases that require treatment, or how do you actually ensure that this happens?
Some of those children do come directly to us through medias and social media, and the others go through the system that the public health has, where they have assessment clinics, and with shows like yours and radio and so on, more people are being exposed to the information to come to the hospitals.
All right. Dr. Nokani, clearly the clinical features are quite obvious. The child will have this, that's right.
Yes.
But do we know what causes this? We said that things don't, something happens that goes wrong during pregnancy. Do you know what causes all of this?
It's quite multifactorial.
Yeah.
There are those that are associated with the gene defect, and then those are, of course, that are associated with environmental factors. Things like your infections, syphilis, for instance. If the mother contracts syphilis while they're pregnant, there's a possibility that they may have a cleft. Drugs, things like phenytoin, which they use to treat epilepsy, that has been shown to cause clefts. Valproic acid as well, and alcohol, unfortunately. And she might be aware that in the Western Cape, we actually have the highest number of what we call fetal alcohol syndrome in the world. And most of those patients do have not only cleft defects, but they also have other facial defects.
So as you said earlier, there's often an association. So, so you're saying there's a strong association between fetal alcohol syndrome and cleft palate?
Yes, definitely. Yes. Yeah.
So all these lifestyle issues around pregnancy.
Exactly, and it also goes with the timing of what we call a pterogen, something that causes this defect to take place or interferes with the development of the child. So if, for instance, as I said earlier on, by the 4th week, that's when the face starts developing, and you start taking alcohol, clearly it's going to interfere with the development of the face, and the baby will end up not only with a cleft, but other also defects that are associated with the face. So that interaction is very important, that you stay away from things that
all
will...
the bad things.
Yeah.
Okay, we're going to come back to how we can prevent all of this later on. For now, time for a quick commercial break. When we come back, we'll continue our discussion on cleft lip and palate. Please stay with us.
Everyone wants a dignified funeral.
That is what a clientele funeral plan can give you. Lasting dignity.
I just want my family to be there, all relaxed, not worrying about paying for anything, knowing that clientele covered everything.
I would like a dignified funeral, and the rest should be invested for my children's future.
Clientele funeral plans pay out in 24 hours. We will even send 200 Rand airtime. You can cover up to 13 people on one plan. Plans include grocery, unveiling, and transport benefit. Plus, you can get all your premiums back.
I told my family, I don't want a fancy funeral. They must come there for a cook sister and a sandwich, and then they must use the rest of the money for their future.
I will never stop paying my monthly premium. To me, paying my monthly premium is as important as buying groceries.
SMS LIFE to 31043 and we'll call you back.
To be a part of something like this makes me proud, and I think that to be able to report the news in a fair, just, independent and impartial way is what the public broadcaster stands for.
My name is Enoch. As a young boy, I learned to be alone, but I also learned to be kind and to be imaginative. I wanted to be known, seen, and heard, but people did not want to know me. They thought I was ugly. I had a smile they did not want to see. So I learned to stay out of sight. I walked by people's homes and gardens like a shadow, so I would not scare them. I would go days not saying a word to a single person. For 25 years, this was my life. I was Enoch, and it did not matter. But then I met people who were not scared of me, who gave me a smile people wanted to see. Surgery made me visible to everyone. Today, I am known, seen, and heard. As a grown man, I am still kind. I am still imaginative. But I have learned I do not have to be alone. The very people that used to run from me run to me. They see me and they use my name. Enoch, who I have always been.
All right, so this can obviously have a devastating effect, not only on the sufferer, but on those around them. Anyway, let's introduce our next set of guests to share their personal stories with us, and a professional. First up is Sylvia Mkunu. Sylvia is a parent of a child born with a cleft palate. Welcome to Health Talk, Sylvia.
Thank you for having me.
All right. Next to Sylvia, we have Nonhlanhla Khoza. Nonhlanhla is a speech therapist who has quite a lot of experience in dealing with children and parents, obviously, of cleft lip and palate. Welcome to Health Talk, Sylvia.
Thank you for having me.
All right. And next to Nonhlanhla, last but not least, is Kelita Hoffman. Kelita is also another parent of a child born with cleft lip and palate, to share her personal story with us. Welcome to Health Talk, Kelita.
Thank you for having me.
All right. Perhaps let's start with you, Sylvia. You have a child that's how old?
She is 5 years old now.
5 years old.
Yes.
Just tell us about how this happened, when you know, the child was born, and how this affected you.
Okay, my daughter Princess was born on the 11th of September in 2013. The hospital in Jamison Betakowa. That's when I gave birth. After I gave birth to Princess.
So before you gave birth,
okay,
did you have any knowledge that there could be something wrong?
No, nothing at all.
Okay, were
Yes,
you
I
going
was.
through the normal clinic, and
Yes.
you know, nobody told you anything about it?
Nobody told me about it. It was the normal, you know, from going to the clinics, everything. But no one told me this is going to happen.
Yeah.
I only found out about it when I had Princess on the 11th of September. On that day, that the nurse who helped me also didn't have like information. She was shocked as well. But she called a sister in charge on that day, who was the one who explained to me. Luckily, there was this doctor from the hospital, Dr. Kola, who was the one actually who explained to me what's wrong with the baby. And it was so painful because I've got other kids as well, 3. Princess is the fourth and last one. So it was
And
so
the
hard.
other 3 children had
The other
no
3,
problem.
you know, are normal.
Right.
They're healthy.
Which is
they-
normal too, but
yes,
they didn't have this.
Yes, they didn't have like a facial condition like Princess.
I get it, yeah.
So the doctor told me they won't discharge Princess. They have to, like, you know, take some tests, you know, observe it, then they'll tell me when Princess will be discharged. Unfortunately, I was discharged each and every morning. I used to go to the hospital. Then there was this special lady, she was a nurse as well. She helped me, you know, understand, because I was so hurt. I remember on that day, I cried a lot, because I was asking myself, what happened with this baby? I already have like 3 kids, and they're perfectly, you know, fine. I asked myself, you know, actually I asked God this question, why me? Why God this time? Because I couldn't have answers. So Dr. Kola and the nurse from the Betakowa, they were the ones who helped me like open, you know, via internet Google to show me pictures that there are babies that look like Princess, and her Princess condition is not permanent. It can be like fixed. That's when I had an interest via Google. The whole family, we were so eager for Princess to know, to look like her animal.
So tell me about the family. I mean, it was difficult for you. And what about the rest of your family?
It was so difficult because on that very same day, they were expecting me, you know, having a baby, whether I'll tell them the baby is a boy or a girl. I told them the baby is a girl. Then I had to explain again that the baby is not okay. There were questions they were asking, what's wrong with the baby? I couldn't explain to them what's wrong with the baby. I just told them the baby was not okay.
Right.
That's it. Then I had to go home, whereby I've got a boy. He's 17 years now. During the time, he was the only boy in the house, and he was expecting a baby boy, you know, a brother to play with.
Right.
So I had to go home to tell him that I had a baby girl. Firstly, I had a baby girl, of which he was disappointed. Then I needed also to explain to all of them that, you know what, this baby girl is not okay.
Yeah.
So I had to prepare them that there is something wrong with the baby, because I couldn't like also explain to them what's wrong with it. But I had to prepare them. The baby will be soon discharged, and there is also something wrong with the baby. For my husband, it was so shocking as well. He was heartbroken. Because every time Princess was around the house, it felt as if we should like maybe hide Princess because he was not prepared. There were going to be questions from the family. Like there were a lot of stories, you know, as well. Like it's a curse.
Yeah.
It's witchcraft, of which people are saying it's a curse, it's a witchcraft. That's why our babies are born like this.
Quite difficult,
But
isn't
yeah,
it?
it is difficult.
Let's hear from Kelita. Kelita, your baby is a little younger, 2 years old, yeah?
Yeah.
Tell us about...
So my experience is a little bit different. I planned my pregnancy.
Right.
And this point kind of links to the discussion we had about causes.
Yeah.
I was planning to have a child. I was on prenatal vitamins. I was not drinking, no drugs. I was eating. I had access to healthy food and meat and iron and all those healthy things that you need when you're pregnant. And I found out that my child was going to be born with a cleft lip at 20 weeks of pregnancy.
20 weeks?
Yes.
Okay.
At that stage, we could only find out that it was lip. It later landed up being a cleft lip and palate. And it's a...
So let's start there then.
Yes.
You know, 20 weeks into your pregnancy, you're told, hey, there's something that's not quite, you know, within the norm. And, you know, how did you take that? And
So
what did it mean to you?
For most of us, well, at least for me, you get this word cleft. The lady says to you, I can see a cleft. And you maybe know a little bit, but for the most part, it's completely shocking. From that stage till the moment that I actually had my baby, I went through all the stages of grief. You are grieving the child that you thought you were going to have. And what you thought you were going to have is a healthy baby that had no surprises. Let me put it that way.
Well, I mean, the one obvious question that you probably would have been asked, did you consider termination?
So I got offered termination on various occasions. In fact, on the day that I found out, the lady said to me, I think you need to have an amniocentesis to check that there's something else wrong, and you need to decide if you want to terminate this pregnancy.
Yeah.
So I got offered termination probably every month until I had my baby. So it was something my husband and I actually had to sit down and say, do we want to terminate this pregnancy? I decided that there's absolutely no way I'm terminating this pregnancy. And we were going to have to live with the risks that there may be some other problem. Because, you know, there are certain diseases or syndromes that come with cleft. And we decided that we're having this child. So we did. And I decided also not to have an amniocentesis because I wasn't willing to take the risk of miscarriage, which, even though it's a small percentage, it's also a small percentage that you're going to have a cleft, and I felt like I was already in those numbers.
Yeah. And around the birth time?
Around the birth, I was completely overjoyed. I saw this child and I didn't realize how happy I would be to meet this child. And I didn't realize that I would love the child as much as I did, and also that I would just look at the child and just feel like nothing was wrong with the child. So I looked at that child and I just felt like nothing was wrong. And that links to the point that when eventually we did have surgery, I actually felt a little sad because I had seen this child for 3.5 months with this big, wide smile, and suddenly they're taking that away. So I actually had to I felt like I had to meet my child twice because you have this child and I absolutely fell in love with him and I didn't want him to change. And then you put your child through surgery and you are hurting them to help them. And then you have to see another child. So I actually didn't, I got quite a fright when I saw him after surgery because he looked completely different. And it's not what I'd recognized.
Okay. And I believe that, you know, he's had 2 more operations?
So he had he had 3 months of orthodontics, which is one way that clefts get treated, to try and narrow that gap as much as possible with orthodontics in order to prepare them for surgery. So he actually had 24-hour-a-day orthodontics on his face with stickers on his face and a device permanently in his mouth for 3 months. He then had a cleft lip surgery that repaired his lip and nose, and then he had a palate surgery at 11 months old, and then he had a non-related surgery at 1 year old.
We're going to come back to you know, the treatment part. But just lastly, before I speak to Nonhlanhla, clearly you had time throughout the pregnancy, the rest of the pregnancy, to deal with the fact And I would imagine at the time that the child was born, you had already, had time obviously to deal with that. But what about the impact on the child? I mean, your child goes to crèche. Any issues around
now?
Yes.
So I think now I feel like there is an impact on the child. Firstly, the family members are all worried about this child.
Yeah.
This is this is the child in the family that's the concern. And also, I believe that he's suffered a lot of anxiety and trauma.
Right.
And his behavior reflects that. Yeah. He gets very anxious in a lot of situations. He doesn't want to be around new people. He can recognize a hospital and a doctor's room from a mile away. He can smell that room, and he will react. Okay. And people in his school, his friends, the parents, everybody asks me about it. Everybody knows about it. People want to know. They want to know what's next. They want to know if there's anything next. Yeah. And you hear all the comments that come with that social stigma of having a birth defect.
No, I mean, obviously, I wanted to have spoken to you a little longer now, but surely one of the impact that a cleft lip and palate has on the child is the ability to communicate or speech. Just take us through it.
So actually, you've mentioned it is the ability to communicate, but initially when the child is born, it's actually the feeding that is the most...
the feeding
issues.
Right.
So what usually happens, because depending on the type of cleft the child has, if especially they have a cleft lip, they're going to have difficulties with the lip seal or even sucking. So initially, as speech therapists will be working firstly, initially, making sure that the child is able to suck. Depending on the severity of the cleft lip, sometimes the child may not even cope with the normal bottle or even with their breastfeeding. Yeah. So we'll actually maybe specialize or order a specialized bottle, which is a Mean Johnson bottle, whereby this bottle actually helps or assists the child with the lip seal and the intraoral pressure while waiting for surgery at 3 months. So initially, while preparing this child for surgery, well, as she has mentioned, that the child usually has a tape, which is a transport tape, which is usually we give the child so that we prepare the muscles for the child so that even when they go to surgery, the muscles are much more closer together so that the surgery becomes much more easier once they go under the knife. So after that, when the feeding, we've established that it's now becoming much more better, the child will have communication difficulties. So what usually happens, especially with the child who has a cleft palate, is that they have difficulties with the velopharyngeal closure or with velopharyngeal functioning, whereby the oral cavity is now open to the nasal cavity. So that closure doesn't seem to be forming. So what will happen is that the child will have hypernasal speech, and it will make them sound very unintelligible to the other peers that are playing with them. Yeah.
So they'll be talking as if their nostrils are blocked, as it were?
Yes. Okay,
and obviously. So what do you do for them?
So initially, there's different types of velopharyngeal dysfunction. So we have your velopharyngeal insufficiency, whereby it's more of an anatomical structure. Yeah. So for that, they need to go under surgery. Okay. Then after they've come after that, then they can work on speech function, because it's more of a functional aspect. Because even though the structure has been repaired, they still need to work on how to use this function as how to make the velar pharyngeal to work even more proficiently.
So I mean, the ability to communicate is not just speech but hearing as well. Is hearing affected at all?
Yes, definitely, because your children with the cleft palate, looking at the anatomy of the eustachian tube. So usually the tensor velo-palatini, which is in the middle ear, is responsible for the function of the eustachian tube. So usually children with cleft lip or palate have that tendency of having nasal leakage that goes through the nose and can affect usually the hearing aspect. And they're mostly likely to have middle ear infection, or sometimes are prone to having otitis media, whereby there's always discharge coming out of the ears. And mostly like those kids, we have to work with the ENT closely so that we can monitor their hearing very close.
Okay, I think this is time for us to go for another quick break. When we come back, we now start talking prevention and treatment. Please stay with us.
Life can throw all sorts of surprises at you, often when you least expect it.
Sorry, Mom.
That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
Okay, welcome back and thank you so much for staying with us. If you've just joined us, we're talking birth defects with a focus on cleft lip and palate. And our guest in studio is Dr. Amy Nokaneng, who's a maxillofacial and oral surgeon from Wits University. And we also have Moira Guest, Operations Executive Director at Smile Foundation, and Kelita Hoffman, who's a parent of a child with cleft lip and palate. Let's start with you, Dr. Nokaneng. We're trying to look at the issue of prevention. I mean, clearly we've heard how devastating this can be potentially for parents and the sufferers.
Yeah.
We spoke earlier about the possible causes. We can't do anything about the genetics.
Not much.
But I'm sure some of those other issues that may be related, whether or not there's strong evidence or not, let's leave that out. You know, let's just talk about what can be done in principle.
Those things that I've spoken about before, especially the alcohol, definitely a no-no during pregnancy.
Right.
And if you are taking any drugs that are prescribed, perhaps, the best thing is to speak to your physician or your doctor to ask them what are the potential effects they would have on your pregnancy and to try and avoid, if you can live without them, do them. For instance, the drug that I mentioned for treatment of epilepsy, see if there's any other drug that could be used as an alternative for you to carry on with your pregnancy while you're not neglecting your epilepsy treatment. What is also important nowadays and what we encourage is that people should have antenatal screening. As she said, which I was quite impressed with, that it was picked up at 22 weeks. Already by 17 weeks, actually, you can actually pick up.
Well, just on that, I mean, clearly in the case of Sylvia, it wasn't picked up. And she was going through normal antenatal clinic. So in essence, I mean, we're saying, it just depends on where you go. What type of unit,
and whether the people
clinic,
who are doing your antenatal screening are informed of that and whether they're able to pick it up. But the advantage of doing that is that you are able to deal with the psychological trauma as a parent. And then at the same time, it allows you to be focused on the baby when the baby arrives, unlike having to deal with that and the baby at the same time. And you also learn to get information on what the condition entails and what your journey will be like. And then you also get to meet the doctors who will be involved in managing your patient, I mean your baby.
Moira, I don't know what your views are, if you have any, on genetic counseling, because, you know, there's the issue around, you know, some sort of genetic link to some of these things, and people are starting to talk about genetic counseling. Any views on that?
Our NGO at present is working together with geneticists around the country in those tertiary institutions and together with the National Department of Health. So there definitely is something that is valid to look into this and to work with them. However, as you've heard from Doctor, that there are other conditions that are, you know, not definite reasons why the mommy had a child with this kind of condition.
Yeah. Kelita, I'm going to come back to you because I want us to just start with the principles of treatment.
Yes.
So how do we prepare these kids for treatment, and what is the typical team of professionals that look after these kids?
It is definitely a multidisciplinary team, meaning you've got different types of specialists that work together to the best interest of that child. You have the speech therapist here, you need a psychologist to deal with the psychological issues, you need a dentist to deal with the oral health, you need the orthodontist at a later stage to align the teeth, you need a surgeon, you need a plastic surgeon. Surgeon meaning maxillofacial surgeon rather.
Of course.
The treatment would normally start around about 3 months, obviously depending whether the patient is healthy enough to have surgery. And that is to allow for the feeding that the speech therapist spoke to about earlier on, to allow the child to be able to feed. And at the latest, we normally focus on the lip first, so to form that seal when they're able to suckle or form that vacuum within the mouth.
Okay, we're going to get to the technical side of things. From the Smile Foundation perspective, what do you do to help, you know, families in preparation for treatment?
Once they have been assessed by at the clinic in that academic hospital, then we have counsellors in the hospital, and they take them through the preparation, not only dealing with their child, but also the preparation for the surgery. There's going to be a mask on the child's face, they're going to sleep, all those kinds of soft issues that sometimes there just isn't time, you know, before the actual surgery.
Okay. We have a call on the line, but before we do that, let me get your personal story in terms of what you went through. I know you've mentioned that your child has had, you know, 3 operations already, but what sort of support did you get in the period before?
So support is crucial for mothers of cleft children, whether it's medical support and family support. This is a long journey. For most kids, it's 18 to 21 years of treatment. And for me, I got, you know, thankfully I have a very, very supportive husband. So we had a unit that was, you know, strong. We had all the, you know, the counselling, the medical help, the family help is essential. This is a very lonely journey. The birth defect process and just operations. And then you have to prepare your child for surgery. So for us, we basically have to keep our child isolated. Most cleft children often they're often very susceptible to other illnesses and infections. So my son had pneumonia, and he had ear infections and chest infections and a variety of things. So pre-surgery, you just want to keep your child healthy, because if they're not healthy, then they're not eligible to go to surgery. So even a running nose is going to prevent you. And then you have to go through surgery, which is a tornado.
Yeah.
It's a very, very hard process.
We'll learn more about it just now. Let's take, is it Unampi or Unati from Unamko from the Eastern Cape? Welcome.
Hi, this is Namko. I'm calling from the Eastern Cape.
My apologies, Namko. Yeah.
No problems at all. I've also got a daughter with cleft lip and palate. I personally know Moira from Port Elizabeth.
Okay.
Smile Foundation has helped us tremendously. As a result, I am part of what we call the Cleft Friends. I'm a support mom there, so I just wanted to share that it's not as difficult to deal with societal ills as far as the cleft is concerned, but it's a learning curve. You learn as you go, and with the support, it makes it a lot easier.
Well, thank you so much for that call. I'm sure Maura would like to say one last word, perhaps?
That is part of a project. It is a project that is part of Smile Foundation, where moms talk to other moms. They go through a psychological counselling program so that they don't say what they think. It's all about the other mommy and educating that mother.
Okay, all right. We're going to put up the obviously contact details of the Smile Foundation, and I think, you know, it's been put up actually throughout the show, so that if people, you know, would like to perhaps donate, I'm sure you're looking for funds all the time, isn't that so?
Always.
Right.
The doctors and the children are the ones that smile in.
Well, thank you very much.
If you don't mind me adding there, also the internet research, I got to the show through my blog.
Oh yes, by the way, yes.
And actually the producer suggested I show you this. This
if we just can get the camera to show it, yeah.
And one of the great things about that is that you can deal with, well, one of the things about my blog is that I want to speak up about this. It's not a taboo thing. I know it's very, very difficult for a lot of moms to come out and discuss it and share and be with their children around moms of children who do not have this defect.
Right.
And my message is to those moms is that you must come out and talk about it. Yeah. So I share my story on a blog on Instagram and Facebook, and I have a website.
Right.
But the idea is just, basically no matter where you're from, no matter what you're doing, come talk about it. There's other moms out there, and also we can help with the day-to-day things, because it's a journey.
Well, thank you so much for sharing that with us. Kelita Hoffman, parent, obviously proud parent of a child, obviously who's gone through treatment. Well, time for another quick break. When we come back, we now finalize, or at least wrap up our discussion on cleft lip and palate. Please stay with us.
Life can throw all sorts of surprises at you, often when you least expect it.
Sorry, Mom.
That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
We at Network explore all things technological.
The modern battlefield is the battlefield of the mind, and the tools for affecting the mind are social media.
We look at how technology advances medicine and education.
Children can learn up to 60% more information in a shorter condensed amount of time using virtual reality as a medium for instruction.
From music, gaming, even computer-generated supermodels. Be a part of our network Saturdays at 8:30 p.m. and Sundays at 5:30 p.m.
Okay, welcome back and thank you so much for staying with us. We're now wrapping up our discussion on cleft lip and palate. We still have Dr. Emino Kaneng, maxillofacial and oral surgeon, Nontantla Koza, speech therapist, and Sylvia Mkunu, a parent. Now, Doc, let's start with the principles of treatment. Obviously, we've spoken about the principle of treatment.
With it, but what I would just like in closing to say, it's not just a once-off treatment. There are different stages in the life of the child until they're about 18 years old, when they stop growing, that they will always need treatment.
We've seen in that clip, I mean, that gentleman who's I mean, you know, he's in his early 20s, essentially.
And at each stage, you have to address a specific issue.
Right. No, the question of support after, you know, the operation, or at least after one or the first or the second or the third, whatever the case might be, is quite crucial. And as a speech therapist, there's a crucial role that you play in that regard. Please take us through that.
So basically, we have to first, the child needs to attend therapy for feeding to make sure that feeding is still not having an issue regarding that. And then there's therapy for communication as well. But one thing we need to also think of is that within the public sector, there's a certain age whereby a child can be seen in the Department of Health. And then after that, the therapist can now refer this child to Department of Education because they're going to have learning difficulties, especially if they're detected to having a hearing loss. That's going to make them have a language delay, meaning that in a normal mainstream school, they may not even cope. Therefore, therapy, as Dr. Amy has mentioned, it's an ongoing thing. It doesn't stop at any stage. It needs to be monitored very closely, as much as the hearing aspect also needs to be monitored very closely, especially if they are susceptible to having middle ear pathologies.
So that issue around, you know, talking as if they have their nostrils blocked, you know, how long does it last? Does it get better with time generally, and how do you work with it over time?
So it depends on the severity of the palate. So if it's just insufficiency, meaning that it's a structural thing, usually after surgery, the child should actually be able to speak much more better. But if it's more like the velopharyngeal, because of the mislearning, the articulations, the phonemes and all of that, therapy needs to be ongoing depending on how the child is coping and how they're adapting to the therapy session. So I cannot say specifically it takes six sessions or it takes a month. It's an ongoing thing. It cannot be determined by just, every child is very different.
So Sylvia, I mean, earlier on you described exactly how wonderful a family you had, all the support that you had from your husband, your siblings, and all the family around. But for other mums, let's agree, I mean, you know, it can be quite tough. You say that you play some role, supportive role, to other mums through the Smile Foundation. What does it entail?
Okay, there's a project by Smile Foundation which is called Cleft Friends, whereby we offer support to other mums. I'm one of the support mums for Gauteng. We've been trained to be support mums. We are emphasizing most of the time we are not actually doctors, but it's like a support from a mum to another mum, because I've been there, done that. So it's easier to tell the other mum that, you know, you're not alone. We are together in this, and also been there as well. So we've got our WhatsApp groups whereby we are chatting, sharing our journeys, you know, but whenever it's difficult, it's so easy to tell mum, please go to the doctor to ask about it. But, you know, generally, for my side, I'm saying, you know, I'm enjoying doing this because I'll be able to help other moms, of which I never had it. The only support group I had was through Via Smile Foundation. They've helped me through with the princess surgeries as well, the counseling from Smile Foundation. Also, they offer like for transportation from home to the hospital. So that's the only support I had from Smile Foundation. They are actually playing a role in my part because I call them also part of my family. So now it's easier as well to share this information with the other moms because some of them, you know, the stories they'll be sharing with you is so painful. Others will tell you, know, I don't love this baby. I hate this baby. I wish I never had this baby. Imagine then you have to tell that mom, it's impossible when you say like that. You carried that baby up until 9 months. Then at the end of the day, you'll tell. So it's so difficult, so difficult. And for my side, I found it, I enjoy this. And it makes, you know, each and every day easier for Princess as well.
Well, it's been such an insightful time that I've had with you. Thank you very much for sharing your stories with us. And thank you, Doc, for all, and, you know, Nontantla for the wise words and, you know, all the information that we managed to put. And for you guys at home, thank you so much for staying with us. Unfortunately, that's all we have for you this week. And we're back on the screens next week, same time. I'm Dr. Salom Mateo. Until next time, please do take care.
This week on Trends Travel, we took a short lift to Sun